Hello, my name is Denise Ayes, and I'm going to be discussing the role of social media in healthcare education. Twitter is a tool that can be used to help students learn more about healthcare. It can be used in order for students to be able to retweet the latest medical information that has been discovered, to retweet the personal stories of others that are going through the illness that they're studying about. Um, they're able to demonstrate that they've understood the concept by being able to explain it in the short character space that is allocated to them in Twitter. One way that students can use Twitter is to create a Twitter account that demonstrates their progress of learning a specific illness or medical concept that they're exploring in class. As Boss said, being able to collaborate and see perspectives that would normally be unspoken is an advantage of social media, and this is something that can definitely be better understood through social media, in that students would be better able to gain the stories of the patients that normally wouldn't have a voice in the literature, so that they're better able to see the symptoms and understand that some of the treatments, while are effective for a lot of people, there are specific patients that they have to be more careful about and explore different avenues of treatment with. If something like this, which is a blog that contains a list to a different amount of sites of people with specific illnesses that document their story, their symptoms, their day-to-day life, is their treatment, is something that could allow students to be better able to understand how the illness actually affects a human being, that they're able to see the impact that their work would have in the future. Social media allows us to be able to think of new ways to explore healthcare education. It is something that allows us to be able to communicate better, to figure out different methods of teaching that would work the social media platform that generally wouldn't work in something that's a bit more traditional, because this allows us to be able to connect the students with professionals and without having to schedule the lives of everybody. It also gives us opportunities to connect the students with professionals that generally wouldn't be able to come into the classroom to speak with the students. Another advantage of social media is that it allows us to get up-to-date information. It is something that is instantaneous, so therefore any new studies that come out can be immediately talked about with colleagues, with peers, with other people with illness, just a vast variety of people. It also allows students to be able to connect, to discuss new findings, and to discuss case studies and what the treatment options would be, and to explore different avenues and different diagnoses and different things that can occur in medicine, so students can gain more practice towards these skills for their future. You're